Welcome back to the show.
What's
this
up?
is Green
What's
Room
up?
Radio. What's up, Domo?
I think I have a doctor checkup.
Yes. A doctor? You brought in a doctor for a physical?
Health is wealth, right?
Very good. That's
From our
that's my
lovely
tagline.
guest.
So who is our guest today, Domo? From Blindspot Medical.
Yeah.
Yes.
So Dr. David Boyd.
David Boyd.
Yeah. So founder and CEO of Blindspot Medical
And where is Blindspot Medical
in
located?
Phoenix, Arizona.
Phoenix, Arizona. How do you like it out there?
I like it, man. I've been there for probably about 12 years now, so it's home. You know.
Is that where? So before you became a doctor, is that where you went and did all your med stuff in Arizona?
No. I was kind of everywhere. So I grew up in Miami.
Wow.
Which was a really cool town to grow up in. I mean, I grew up around all kind of different cultures and foods and just everything. So it was a cool town to grow up in. And then after I finished college there, I actually went down to the West Indies for med school for a year and a half, and then finished it in New York City.
Wow.
Yeah.
Wow, that's
That's
you
quite
went
a jump
from Miami to So actual Miami. So
Yeah.
is that what is that Dade County they
Dade
call it?
County, yeah.
So wow.
And that's how
305.
you get, practice, because you have to do practice hours.
Yeah, so basically after you finish med school, then you have to do residency.
Yeah,
And residency is kind of like an extended apprenticeship.
sure.
And that was in Richmond, Virginia. So did that for those 3 years.
How was that? Was that a culture shocker?
Yeah, it was different, man.
So I always said, I'm like,
Virginia
man,
Beach.
something I get
Cool.
worried about out here is I'm a little bit worried about the medical staff here in Las Vegas.
Yeah.
My dad had gotten a melanoma skin cancer
No kidding.
and passed away, but they didn't even have stuff to treat him.
Yeah.
So they had told him, they're like, I would go to California if I were you.
Sure.
And we were from Michigan, we were from Detroit. So he ended up going to the University of Michigan. But I just don't feel like, I mean, I don't know. I can't say it fully, but I just don't feel like the medical system here in Vegas, I think there might be too many distractions for.
So, I mean, years ago, I used to work for one of the major cancer centers in Phoenix. They're a nationwide cancer center. They're pretty big.
Yeah.
And we actually we'd have a ton of patients coming from Vegas, just because it's something. It's like
Right.
Vegas told my dad. I mean, they didn't say like, "Hey, stay here, we can help you out." They said, if I were you, you need to go to a better place. So they passed them along.
Yeah.
So, but yeah, I mean, so you worked in the cancer?
Oh yeah, yeah. I've had kind of an interesting career, man.
What did you go
what
to
kind
medical
of
school
practice
for?
do you specialize in?
So my background's family medicine, so
Okay.
primary care.
Primary care.
But I did that. I did like traditional primary care just for a short time. So it was like for 3 years out of residency, I was doing, your typical office stuff, but at the same time, I was taking care of patients in the hospital. So I get up at 4 o'clock in the morning. You go to the hospital, go do rounds at 2 different hospitals, and then be at the office by 8. See 40 patients from between 8 to 5, then go back to the hospital, admit all the people from the emergency room that were away. So I did that for 3 years. It was exhausting. And then I was like, you know what, I'm gonna change things up a little bit. Also in that time I had done, medical weight loss and aesthetics, and so I learned how to do Botox and
Were you ever a PA?
no.
No. Okay. Yeah, I see a lot. One thing I do see in Vegas, and I've went to a lot of primary care, is the PA is the one
Yeah.
who's been treating.
Sure.
Yeah.
Because it's less expensive to pay them. So, most doctors don't have their own practice nowadays. Like they're usually like employed by some big hospital company.
Yep.
Right. And so because of that, they're an employee. And so just like, any other business or anything, then they just run, the more patients you run through the mill, they'll just keep cramming it onto the doctor's schedule.
So you set out to be a primary care physician.
I actually set out to be a plastic surgeon. That was my initial thing.
What kind of plastic surgeon?
I mean,
Tits.
yeah. I mean,
Ass.
That's
Beauty,
plastic surgeons,
cosmetic,
That's where they make their
Fuck yeah.
It's nose jobs and boob jobs.
Hey.
Right? So that's what I set out to do. And then as I went through my medical training and everything kind of changed, and my interest kind of changed.
Okay.
So that's where it came into primary. And then after I was doing the primary care, I was like, wow, I want to do something a little bit different than this. So there was the opportunity to work at the cancer center, which was cool because I basically would take care of all of the non-cancer problems for the incoming cancer patients, freeing up the medical and surgical oncologist to just focus then in on the cancer. So I learned a tremendous amount about cancer in those 7-8 years, however long I was there. So it kind of gave me almost like a working specialty,
Yeah.
on that.
Yeah.
Was
that hard to work in a facility like
it
that?
was.
See people go through that?
Yeah, because the reality is the majority of the time, those patients lose the fight.
Yeah. Well, something that was crazy. So my mom, she got diagnosed with cancer, and she had a tumor on her heart. She did it here in Vegas. They removed it, and then they recommended that she did 6 of these chemo treatments. And I mean, she did it, and she got a clear scan, thank God. But what was weird is I had a cousin from Michigan call me, and she's like, man, I just want to say, she worked at a cancer institute. She's like, every patient died. And she was like, every single one. And so I was like, well, wow, I'm glad that didn't happen to my mom. But I'm like, she just said it was really hard, to work, get to know these people. You obviously probably get to meet their families.
Yeah.
So usually cancer, I mean, is it beatable? I mean, what do you think the ratios on that is?
So it just depends. It depends on a lot of factors. It depends on the cancer, like the cancer type. It depends when it's found. And then it depends on the health of that person, like to begin with. And that's really actually what kind of was the spark, the catalyst for Blindspot and me creating it in the first place. So I'll never forget it. I remember we had this thing. It's called a morbidity and mortality. And so they do this at like most big hospitals, university centers, cancer centers. They do this, and it's basically it's when a patient dies, you'll have all the doctors kind of get together and say, okay, well, what could we have done differently to prevent this outcome, right? So this was one of these morbidity and mortality meetings, and it was on like a Friday morning or something. And I go into this big conference room. You got to picture this elaborate conference room, this long, long shiny table. There's this full buffet set up in the back, like all
not a buffet of people, right?
No.
Just a buffet.
There's a chef there making omelets. There's every pastry you could want, fruits and that, like all this stuff. I'm like, this is kind of elaborate for a freaking morbidity and mortality meeting, So whatever. So we have breakfast and everything. You're sipping coffee. They put the slides up on the projector, going through, the patient's history and the cancer type. You're looking at it at under the microscope. They have the pathologist there, kind of talking through things and etc. And anyway, they go through all this, and I'm sitting there, and the people around the table, I'm the low man on the totem pole. Like, I'm just the primary care doctor, right? But you have like the guys that are the specialists in these different cancer fields, and these big shot surgeons, the folks that literally wrote the textbooks on how to treat these different cancers, and they're from all these Ivy League schools, right? And the patient that we were talking about was this amazing lady. She was super sweet, and there was a disconnect with there's no emotion at all, And I don't know where it came from. It was a little unprofessional of me, but I slammed my hand down on the table, and I said, if we have all this great technology, why in the hell are we using it to prevent cancer instead of treat it?
Oh, yeah. Well,
and
that's the big business of the medical field. Yeah.
That's the thing is that's when I put it together. I was so ignorant that I didn't really see there's way more money in treating it than preventing it.
Right.
Right. Mm-hmm. So there was kind of this hush that went over the room, and some people kind of talking, snickering back and forth and everything. And then they just continued. Nobody addressed the issue, nothing like that. And I got up and I left. And so I kind of knew, I was like, all right, my days here are numbered. I'm out, And it was that discord that really was the spark to create Blindspot in the first place. That's why it's called Blindspot. Is to literally look at the blind spots in someone's health to try to find problems when they're small. Because if you can take care of it when it's small, then you can usually either cure it, eliminate it. It doesn't become an issue further down the line.
Yeah.
Well, as I said, I mean, what do you say to people that they're, my dad was one of them, and I mean, I'm actually one of them. The people who don't just don't go to the doctor for anything.
Yeah.
Not generally. I mean, you would say, I mean, I would say I'm generally healthy. I don't really get sick too much or anything, but I'm just not a doctor person. And I mean, I know it's,
Most dudes are, man.
you know, and that, well, you know, my dad, it was crazy with him was, you know, we were all focused on my mom.
Yeah.
And then my dad was 75 and he ended up with the melanoma skin cancer. So he's Irish and my mom's Indian. So him and my brother are light-skinned, blue eyes, which they said those people are more susceptible to the skin cancer. But he had 2 triple bypass heart surgeries, one at 40 years old and then one, I think, about 15 years down the road.
Oh, man.
So when he developed this, I mean, it was as simple as getting a mole check.
Yeah.
I heard you talking on one of your videos about a mole check.
Yeah.
And, you know, he just didn't do it. You know, he looked like a very healthy guy, looked young for 75. And, yeah, I mean, it came. And what happened was he had got a lump on his chest.
Yeah.
And then 2 and then 3. And then that's when he went out here and they were like, you know, what you need, we can't do nothing. And I think it was because they said they couldn't remove the tumors because of his heart surgeries.
Oh.
You know, so that's what ended up, you know, getting him over to Michigan. So, you know, something I thought, something that I saw, I don't know, how do you guys feel in the medical field about the doctors that are at the VAs?
I mean, man.
Well,
See, my dad went because the VA was hooked to the
Yeah.
University of Michigan
I see.
under the impression, you know, like, you know, you're getting guys from Michigan. Michigan's a big medical school.
Yeah.
But to me, and I mean, I know her
and
dad
my,
had
my
some
dad
issues.
was a VA vet, and I wasn't fully happy. Like, actually, I took on the responsibility of taking him to like his doctor appointments, you know, so my mom and him can get a divorce. And she took care of a lot of the things. And I think at the time before I did it, I never went to his doctor appointments because I was like, you know, my mom does that. So then when I was doing this, I started to get like, I took him to a few VAs because I was trying to have him move towards LA towards me. And oh my God, like, first of all, like, you know, you make an appointment, they still make them wait. And then if he had to fast because he had to get blood, they're making him wait until like almost like 3 o'clock.
Sure.
And then what really opened my eyes was like, you know, where you leave the office for the appointment to go to the pharmacy, and then they're just like sending him back and forth. And it was just like, you know, my dad couldn't really walk very fast. And I had to stop. And I was like, Dad, you stay here. I was like, you know, because it's all electronic. So they're not giving you a piece of paper with the prescription on. And I had to like go and scream at this doctor. And I said, why the fuck are you guys sending him here and there? I'm like, you're lucky he's here with me because I can go and run and yell at you guys. But I see what you guys are doing. However, you know, that's just me. You know, most of these veterans, they don't have family members that are going with him. So they are kind of getting the ring around. And also, it's just like the lack of respect for not only an elder person, but somebody who is having some medical problems.
Sure.
Yeah, the vibe that I got, you know, when I went in there, you know, and my dad wanted to get out of there, and you know, they ended up releasing him, but like my vibe was like they wanted to get him up out of there. Like their job is to like these guys are
Move them along.
By the time that I started to yell at the doctor, you know, because I didn't have any documentation that I was the power of attorney or anything. Oh, they started to take him into the room to give him, you know, whatever procedures that he needed. And it was really frustrating because my dad was also bipolar. So I'm like, you're trying to tell this patient whatever he needs for his medical needs. However, I'm a family member. I need to also know this information because it may not register correctly or thoroughly. And I mean, I just, you know, it really sucked. I mean, he'll always have prescription, but it was just like prescription. Oh, that doesn't work. We'll just put you on something else. And there was no solutions. However, bipolar is very, very hard. It's a very
tough, yeah.
difficult condition.
Is there a type of doctor that, I mean, is there a type that they send to the VA, or could it be anybody?
I think it can be anybody.
It can be
but
anybody.
It's
yeah.
kind of like, you know, what what thing that you've seen that the government has handled that works out
Yeah,
good? You know, I mean, it's like,
exactly.
Never.
you know,
Well, that's why I said I'm like, it's kind of like what you said about that unspoken thing, and it's like you said something, and you're like, I'm gonna lose my job.
yeah.
I feel like that's how it is there. It's an
I-
unspoken rule, like load these guys up on pills, but prepare them to die. I mean, that's how I felt.
I
And it
had
was-
one colleague that had been a VA doc that had left there, and you know, from what he told me, and he was a good doctor, so it wasn't him per se, but from what he told me, is like, man, it's like you can't get anything done, you know, like it's, you know, like having both hands tied behind your back,
Yeah.
you know,
Yeah.
so you have limited resources, you have like, you know, I imagine a ton of patients, you know, and you don't really have, nobody has your back,
Yeah.
so it's just like kind of like the Walmart of medicine. Unfortunately,
Like going to the
Yeah.
DMV.
yeah, like going to the DMV.
Yeah.
That's a really good. Yeah,
I was like so frustrated because I'm like, Dad, we made an appointment. Why are we fucking waiting
yeah. And
2-3 hours and you fasted, so you're not even eating?
and what's so shitty is like these are folks, they're veterans. So like
Yeah.
they've given like, you know, years and years of their life for
Right.
their country. They've been exposed to who knows what, you know, either going through training or if they were overseas or whatever, you know. And then this is the
And especially
get.
like when they're older,
Yeah.
you know, to give blood, it's not a very fun thing, and it's just like, you know, and these people, they just move so slow, and I don't know, it's just so frustrating. I'm in a sense, I'm so happy because my dad's suffering is over, but it was very, very like stressful to go in there. And it's like I have to be like my dad's like advocate, but my
Yeah.
dad was actually really funny because he started to find little loopholes how to like get around these people. So it started to be like a game to him, but you know, it's just, with all of them, I mean, you know, your percentage of disability is, you know, that's your meal ticket. And I will say, my dad, you know, the government does pay veterans back. I mean, it may not be like super like big amounts, but at least they are getting some kind of payback. But I just think there could be more done.
I'm sure they could.
I've seen stuff like out here, the UMC Trauma Center.
Mm-hmm.
So this was years ago. I was dating a girl and she had gotten like this rash, which turned out to be a bed bug.
Ugh.
Oh,
And it was crazy because I was like, "Is that?" She wanted me to take her, and I'm like, "Is
Ugh.
that contagious?" And
Yes.
she's like, "No." And then I get it. Then I get it on my arm. But we walk in, and it was packed, and they go, "It's an 8.5 hour wait, and if
Good
you leave,
God.
you'll lose your spot." And I'm like, "What?" I'm like, what are you supposed to do for 8.5 hours? And you know, there's people in there for everything. And so I've heard through the newspapers of patients coming in, you know, really ill
yeah,
and dying
Yeah.
in the waiting
Yeah.
room,
yeah.
you know. And I'm just like, so, you know, a friend told me after that, he's like, "Hey, you got to say the key words, like, you know, you're having chest pain or
Sure.
whatever." And,
Yeah.
but I'm just like, I don't understand the backup of that. And then just the inability to know, you know, when everybody's coming there, obviously they're sick or something's going on, but it's like, who's the person determining?
And it's like the morality, like, you know, you see these people. Obviously, I know there's a protocol, there's a system, but it's like
Yeah, but the system sucks.
sucks.
It sucks bad. And so this is one of the things I talk about with folks is that, you know, I take care of like really high level entrepreneurs. So if it's an entrepreneur that you follow on social media, they're likely one
Yeah,
of our
what it
patients.
sounds like you do. I had a doctor out here, one that I found that I loved. He was from Detroit,
Mm-hmm.
and you know, I'd seen him forever, and then my insurance changed, and I kind of lost him in the shuffle.
Yeah.
And then he had told me he had so many patients. He did this thing. It was basically called like VIP doctor. You paid him X amount, and then boom, he's just like, you know, you're not going every month to get your scripts filled. We're doing 3 months in advance, and then you had access to him 24/7, whether it be through Zoom or whatever. And I mean, that's kind of what he did. I mean, he kind of said he was just taking care of the higher, you know, his higher end clientele.
Yeah.
But because he said he was swamped.
Yeah.
You know, and that was the one that I said most of the time that I went to him, I was seeing a PA. I wasn't seeing him.
Yeah.
You know, so I'd always have to be like, "Hey, I want to see him." You know, and you know, he's just too booked or whatever. So is that kind of what you did with your practice? I mean,
Yeah. Yes and no. So it's
Yeah.
it's a step above that. So
Yeah.
that's why I describe it as this, right? So it's kind of like flying, right? So you have coach, you have first class, and then you have private, right?
Mm-hmm.
So coach is kind of what the healthcare everybody has, right?
Yeah.
That's the waiting 8.5 hours in the emergency room,
Yeah.
right?
Yeah.
Then you have first class, and first class is it's a little bit better than coach. It's nicer, right? You have more service, more access, etc. So that's like your typical concierge physician where you like pay them a certain amount, they pay like a monthly fee, but then you still use your insurance, etc. Right?
Okay.
Mm-hmm.
And then there's what I provide, which is private. So it's like getting on a private jet. You go when you want to go. There's no waiting. There's no back and forth. It doesn't matter what you put in your luggage.
So when you say these
Wow.
entrepreneurs from all over, when you're treating them, or is it like through Zoom or?
it depends. Like, so majority of things most things you can handle with phone call or Zoom or what have you. There have been times where I'll make a house call where if I have to fly out to Orange County to like go check on somebody, I will.
So is there a type of licensing for that? Like, do you need licensing to treat in different states or?
Yeah, it's a good question. So it depends. So each one of those patient relationships, they begin in Phoenix because we put folks through this extensive executive physical that I have trademarked as the ultimate human analysis. And I have it trademarked for that because it's true. I looked, when I was creating this, I looked at all the different executive physical programs out there and made a comparison and said, okay, we're going to go a step above. And that's how I created it. So the relationship begins there in Phoenix. And so because it begins in Phoenix, no matter where they go in the U.S., then I can take care of them.
I have a
that
question.
makes sense.
Do you ever treat porn stars or people in the adult entertainment?
I mean, I haven't yet.
Okay.
Could I? Yes.
Do you have more? Is it more males, females, mix?
Just because I'm a dude and a pretty straight shooting dude, that's usually what I attract. So it's the man is usually the entry point, but 9 times out of 10, if they're married, then as the man is getting healthier and with that more energy and more confidence, they're making more money in business because they're showing up differently and so forth. Inevitably, the wife is always like, "Hey, what about me?"
Okay, yeah, that was what I was gonna say.
Can I get in there?
Yeah.
That has to be the ultimate referral.
Yeah.
We had a really good conversation last time we were at the Bradley's studio.
Yeah.
And it was about sexual health.
Yeah.
And, I am in obviously the adult industry is very controversial, but then also it's like, as more people are doing OnlyFans, there is such a lack of like education in, sexual health that, I mean, I can't even believe porn has really like opened my eyes about like how much to be like on top of like sexual health. And, I talk to other fellow like mainstream porn stars. It's just in our nature to do that. But now with OnlyFans and, similar platforms, I talk to people like I'll have guys try to be like, hit me up. I mean, they think that they can collab just because they're on OnlyFans. And and I'll kind of like fuck with them and I'll be like, oh yeah, like when's the last time you test? And they'll be like, well, 4 months ago. What the fuck? Like 4 months ago? Like porn stars do every 2 weeks.
Yeah, real
every
quick.
14 days.
How? So when she's saying porn stars do every 14 days, how accurate can that actually be? I've read articles where things can still slip through the cracks.
Yeah.
What would you say like an ideal test that you would say if they say 14 days? Let's say you said 7. Would a lot less slip through the cracks that way, or?
So it depends on exposure, right?
Okay.
So that's really what it comes down to.
Because somebody could get tested and then 3 days later expose themselves to something and then go over to someone else. But I got tested in the 14 days.
Exactly.
Okay.
So like for example, let's make a scenario. Let's make a timeline, right? So let's say someone gets tested, right? They haven't had any exposures or they're coming off of a negative test or what they've been abstinent for 6 to 8 weeks, whatever it is. Okay.
Mm-hmm.
So then they get a test and they get the results back, 24 hours later. It says, oh, everything looks okay. Right. So then they go and they have sex with someone. Right. And then they have an exposure and we'll say like something like herpes or the granddaddy's like HIV or something like that.
Mm-hmm.
Right. and then 2 weeks later they get a test that's negative. Well, it'll be negative because there hasn't been enough time for the body to literally make the antibodies that the test is looking for.
Okay.
So now they're operating with this false negative, and they're like, oh, everything's fine. And then they'll go fuck somebody else, spread it, check again another 2 weeks, test still negative.
Do they say, I didn't know this, do they say, so like you test, you get a partner, after that, do you test again, or are you still clear for the 14 days?
No, you're still
so that
clear
person
for the
could
14
hook up
days.
with 10 girls.
Well, the issue that was happening, where now I'm a little bit more aware, so I actually don't shoot with males for scenes or something, is, there was some issues of men doing some gay for pay type of stuff under different alias, so then we can't check their work and whatnot. But then also, even girls were, getting tested, going to an orgy or whatever, sex party,
that's
or
actually a great
other
thing.
things.
You get tested, and then you go do one of those. Now you just exposed yourself to, say, maybe 7 people.
Mm-hmm.
And it's,
so
it's the porn star life that people think. And sure, it happens when girls are kind of joining the industry. They might do that. But then it's just like, to some talent, they're like, they don't mess with nobody who's out of the circle.
Sure.
So it's like this weird paradigm that it was also really like also scary, because it's like, I don't know who you were with the day before, or, what's going on, different type of people and the body fluids and stuff like that. Sure. And there's no condom.
Yeah. Because
on most scenes. Yeah.
Yeah. Because that's not the popular
it's
thing.
not sexy.
Right. So the way you kind of had described it to me, we previously saw, so there's like the industry, right? And so the folks that were kind of operating in the industry, at least there's some sort of a standard that's there that people are sticking with. But now with this whole OnlyFans thing, it's like anybody can go start this thing, and there's really no.
What's crazy is I've seen, porn stars, they're collaborating with very big influencer type of people, which is fantastic. But I've also gotten invites and stuff, and there's no test protocols. So it's also a weird, it's like a little kind of like underground type of work, because some of these people, they are still shooting with, talent, mainstream talent. And then it's like, especially like the guys, like I followed a few of the male performers on their OnlyFans just to kind of observe. And it's like, it's crazy. I'm like getting the messages, and it's like the amount of women, and it's like, these are the guys, the fuckers. And then it's like, they're just,
that's what they're called, the fuckers.
I'm just giving that a scenario, but it's like, there's just week after week, different people, different things. And then it's like, you kind of question, and honestly, porn can be a little kind of like Russian roulette.
For sure.
Like
you're
what
putting yourself out there.
So what you're saying is, so you go to do a porn scene, so you both get tested, but then, just even outside of porn, you're not going to get tested when you meet a guy and he becomes your boyfriend, or you're not having him test it, let's say.
Well, some performers,
some do.
Sexual health is very, especially talking about it. I do know of other talent that they're very much vocal about testing and all this, and it is important. But it's, some citizens may lack that kind of very like aggressive, like being disciplined about like your testing and your status.
Well, yeah. I know a lot of adult performers just from being here in Vegas alone. So even outside of this thing, a lot of them are escorting. So now you're bringing a whole nother, you're out of this industry for them, and you're in, I guess it'd be the general public now. And then some of these people that might get escorts, do they get escorts 2 times a week, 3 times?
Or just
So, I mean,
They're
yeah.
going on Tinder and they're just hooking up with guys, which is also really scary that, a lot of performers do it, but I know some of them do.
The reason but from what
Yeah.
from what you've told me, when you say a performer, makes $500, and then if that was your job and you're surviving on that money, and I don't know if they guarantee
it
you.
varies.
Do they guarantee you shoots, like you're gonna get 10 shoots a
No,
month?
this is like
So
it depends. Okay, so depending on your contract, your agency, but the reality is there is so many performers, there really is not enough shoots. So you have all these people just kind of waiting,
And
there's
do you think that's why these
competing.
guys do these gay for pays? Because
No, I mean, the whole gay for pay thing is that male performers get paid much more or less than females do. However, if you are AVN nominated, then that may, raise your pay scale. Amount of experience, amount of referrals. If a lot of good, well-known porn stars are requesting you, that's a good thing, and then that can help in your favor. But, and I think it's just something where the guy is grinding at this low rate, and then, the devil on the shoulder says, hey, instead of you doing that for like $400, would you want to make $3,000?
Sure.
Oh, but it's just going to be a little different, It might be a jerk off. It might be a jerk off video, and then
a little different.
and then
There's
it
not gonna be a girl.
progresses.
Yeah.
Yes. So it's like I don't personally know anybody who actually got that deal. I'm just guesstimating that that's probably what it is, but I have heard of, there was incidents where women started to notice that, and some women even took their life because they were bullied about being vocal about August Ames is one. She was a porn star, and she was actually married too, so she was very adamant about who she was shooting with, which is great. But the issue is that she went on Twitter to express this kind of in the industry kind of stuff, and basically saying that she didn't want to work with a male performer because he did do gay for pay, and she just got bullied and mortified also by some people in the adult industry saying that she was homophobic.
Well, here's going into a conspiracy theory, because I remember reading about that story, and I'm like, the adult entertainment people that I know, they are probably the most thick-skinned people. So to hear that just people were heckling her, about basically saying you have a problem with gay people, I, going the conspiracy theory route, is I'm like, is that the industry taking her out for making people aware of this is going on? Because it just, like I said, most girls in that field they're pretty tough people. You can't just say.
I don't think it was anything like that. I think it was because she got more ridicule from people who were not in the industry. She was well known for, like she had shot with a lot of production companies. So when you are putting yourself out there and your fans, they get lost in the fantasy, and they think that your persona is your person, who you are in real life. And she wasn't. And so they just, and, there has been issues where sometimes if a girl, maybe she's like a girl performer, and then she works with like men, that like some of her fans can't handle that. And so they'll attack her, or they'll, put hate and troll on not only her, but even like the male performers, because they just like, they're so hung up on who she was playing in these scenes that they really, like some of them genuinely think, especially at the time. This was before
Kinda
OnlyFans.
like WWE.
Yeah, a little bit.
That's a good comparison.
Actually, a little bit.
I remember going to my first WWE event, and I was like, is this for real? I'm seeing full dads going crazy,
Yeah.
and I'm like, am I really seeing this? Like, so I mean, I think it could be like that. Do you find in medical, do guys generally go with guy doctors, girls with girls?
Yeah,
I'm trying to
usually.
think if I ever had a girl doctor, and I mean, I probably have at some point, but is it just a comfort thing that guys go with
I
guys?
think so. Yeah.
Yeah, because I know I just did the mold check and they
Good.
were removing them or whatever,
Yeah.
but there was a girl in the room,
Yeah.
but then she left the room,
Yeah.
and I think normally they stay, but she left, so I'm just like I don't know if that's. And I was like I can't imagine maybe if a girl was the one removing the moles or whatever. I
Yeah.
don't know how that would feel.
In general, but it's also like, it kind of goes with depending on the age. So like I'm 45. So most of my patients, they're like, 35 and up, And so at about that same time, that's where they're like, hey doc, can you hook me up with some Viagra? So if if it was, I think they're probably gonna be more comfortable speaking to another guy.
Sure.
Yeah.
And I'm sure them asking a female doctor isn't probably.
Hey, I'm gonna tell you something really
Comforting.
funny. My doctor that I go to, and I'm gonna get into this with you because I heard you talk about testosterone. So
Yeah.
I'm on testosterone,
Uh-huh.
and and I was still telling him, I'm just like, man, I still feel really tired. He told me my level this last time was high. I was doing the one ml a week. And he was like, I need you to go down to 0.75 because I think he said I was a 960. It was something where I want to get the thing and I want to send it to you because
Yeah,
it was
I'll
the
look over it.
results of everything. But so I was like, he's like, do you have any sex drive? And I'm like, I really don't. And so when he gave me my normal scripts, he put a Cialis on there,
Mm-hmm.
but he didn't tell me that.
Oh,
So I go pick up my scripts
yeah.
and I leave. And then I'm getting blown up by Walgreens saying, you have to come get this like today. And I'm like, what are they talking about? I'm like, and I was telling her there's this little Vietnamese lady that works in the pharmacy. And I'm like, I think she has the hots for me. And I'm like, and of course there's the 21-year-old assistant that's hot. And they're looking at me and I'm like, why are you guys calling and texting me? Like I already got my scripts.
Yeah.
And they're looking at the screen and they're looking at me and she was like, oh, I can't even give you a discount on this. And I was like, on what? And she's like, you don't know why you're here? And I was like, no. I'm like, I take this, this, and this. And she's in Vietnamese. She said for ET.
For ET. Yeah.
It's meaning ED.
Yeah, yeah.
But I said ET.
Right.
And I was like, what is ET? And now her and the girl are laughing.
Right.
And I'm like, she's like, erectile dysfunction. And I'm like, I don't have erectile dysfunction. Dude, I've never been so embarrassed in my entire life. And this lady's like, these are $20 a piece.
Yeah.
And so my
Whoa.
doctor, who's my friend, it's 11:30 at night, I called him and he answered.
Yeah.
And I said, Dr. Wayne, I said, did you give me Cialis? And he's like, yeah, I wanted to get you back in the game. And I'm
Thoughtful.
like, yeah, and I'm like, I'm in the game. I'm
Yeah.
like, what do you? I'm like, you need to tell me. And he was like, with the Super Bowl coming up, like he was being funny about it. And I was like that. Two things were crazy. One, him doing that without even telling me, and I did not ask him. But two, just the fact that they were $20 a piece.
Yeah.
Why is that?
Because people will pay it. That's why.
But insurance companies are like,
Fuck no.
they're
Oh,
like, we're not
wow.
gonna, yeah.
No. Man.
Well, I had said, there's, I know a lot of weightlifting buddies, and they'll be ordering these from overseas,
Yeah.
$1 a piece or whatever. But
Sure.
my doctor's like, I wouldn't recommend trying any of those or whatever. But I'm like, I tried one time in my life, probably about 5+ years ago,
Mhm.
and it gave me a migraine.
Yeah. Because
And then the doctor was like, well, because you didn't need it. Or what would you say it would be from?
Well, because that's how it works. It's a vasodilator, meaning that it opens up blood vessels, right? So it opens up blood vessels everywhere, including the ones in the penis for sure, but
Yeah.
including the ones in your head. So it kind of gives you like a pressure headache.
Well, that's what it
Is
actually.
that
It
why
actually.
guys usually have like a headache
Yeah.
when they first take it?
Yeah,
Oh, it ruined my whole day.
for sure.
I was
And
just like, oh my god.
and the stronger the dose, the stronger the headache that comes along with it. So that's part of the gig.
Well,
And it motivates them to like use all that
no, but I mean,
blood vessel
they'll
openings.
tough out the headache to have sex. The whole excuse. Sorry, honey, I have a headache. It doesn't hold there.
Yeah, so
Yeah.
I had a friend tell me, and I mean, this kind of sounds like what you might do, but he was telling me that there was he got something. It was a group of doctors out of San Diego,
Mm-hmm.
and they were doing, I think it was like $3,000, but they were doing like full panels,
Mhm.
and that's what they're doing. If you're on testosterone, they're looking at your levels, and they're making everything work with each other,
Mhm.
like the Viagra, making sure your levels, and basically, I think doing a scan, like you said. Uh, but I was just like, I was like, I don't know. I
So
don't
you
know.
can peacefully take it,
So you can peacefully take it. Yeah.
knowing.
Well, what the thing that was funny, the Vietnamese lady, she gave me 20 milligram,
Mm-hmm.
and she's like, these are so expensive. She's like, if you don't need it, break it in half.
That's true.
That's what she told me. She's like, then
Yeah.
you get two, so then it's like $10 or whatever.
Yeah.
But then I'm thinking to myself, these weightlifting guys I know, they're selling 50 milligram, or I've even heard people say 100 milligram.
The 100 ones, they look like they're massive. It's like, if you've ever seen the pill, it's like the size of the tip of your pinky.
Yeah,
It's a massive pill.
well, I don't know because it's I think these guys order stuff from China, so I don't know if it would be the real pharmaceutical. But so basically, health insurance doesn't want to support ED in older men,
No.
or do you have to be a certain age?
Oh wow.
Yeah, no, they're kind of.
They're not gonna.
No.
They're gonna be like, you're gonna pay.
Oh, I did not know that.
Oh yeah, they'll be like, go fuck yourself. No, or don't.
Well, you know what she said. She's like, if you don't need these, she goes, tell them to put in for 5 milligrams.
Yes.
And he goes, maybe your insurance will cover that.
Yes.
Maybe. So she's like, try that
That's
route.
a
But I'm
work-
like, again, ladies.
That's a workaround.
Yeah.
So, and it's a workaround because one of the things, and I'll go ahead and preface this by saying I'm not giving medical advice.
Yeah.
So this is not on-air medical
Disclaimer.
advice for folks. This
Yeah.
is just, it's for education purposes only.
Yeah.
And I'm not saying people go do this. But that being said, Cialis 5 milligrams, you can actually, for guys who have BPH, benign prostatic hypertrophy, swollen prostate, which happens to every guy. It depends at what age. There's some guys it happens at 40, other guys it doesn't start till 80. It depends on the person. But for BPH, Cialis 5 milligrams is written for once a day because it helps to just kind of open up the urethra as it passes through the prostate so guys can pee easier. And the side benefit is, it helps with erectile dysfunction too.
Well, I had a bodybuilder guy tell me, and I want to say the ones he was selling was 50 milligram. And again, I don't like to take medical advice from these bodybuilders, but he was saying that he takes it every 3 days. And he was like, he takes it because he said it gives you a natural pump. And somebody who actually said that was when John Jones got in trouble in the UFC. He wasn't taking it he said he wasn't taking it for male performance. He was taking it for, I guess, other benefits.
Yeah, probably vein porn.
Yeah, no,
Right.
that's what I think it was.
It literally opens up your blood vessels, so you probably get,
Yeah, well, that's why I think the bodybuilders
vascular.
were saying. Well, the bodybuilders like, well, I do that, and so he's like, so when the time comes, I'm already ready.
yeah.
But he's like, but I'm taking it every 3 days for the pump or whatever, however they want to call it.
I could see it. Bodybuilders do all kinds of stuff, man.
I know. That's why I said
Not
they're-
always the healthiest thing, but
no.
I have a lot of patients of mine that were like former pros, that they have been taking, anabolic steroids and this and that and everything. They come to me and they're like, man, could you, we'll look at their labs and be like, what the fuck? And then it's something because you look at these folks and they look amazing, right? So in your head, you're like, well, you must be incredibly healthy, right? Because you look this good. But in order to get there, a lot of the things that they do aren't the most healthiest things.
Well, that's why I said, like a lot of people, I mean, I don't think doctors can necessarily prescribe all these different steroids that they're taking. But that's what I'm saying. I'm like, you're basically taking medical advice, like, oh, take this steroid, mix it with this one, from people who aren't even doctors.
Right. But on the other side of that, so there is a way for folks to be dialed in and optimized without having to go and use things like anabolic steroids and such that can be really problematic. And that's one of the things that we do is we help optimize people, both men and women. So especially for the 45-year-old entrepreneur that wants to look good in a suit, that wants to show up a certain way, when he shakes hands with, that makes the deal, kind of, has that grip and so forth.
Yeah.
And that really kind of shows up as like an alpha male.
Yeah.
So for those guys, having testosterone dialed in, growth hormone levels right, making sure their diet is on point, that they have a hypertrophy regimen, meaning that they're building muscle appropriately and such. I mean, the fact of the matter is, like, being dialed in and fit like that really, it's become kind of like a status symbol, you know?
Yes.
Yeah.
Yes.
So
It
it's
does.
like it's cool if you have like the presidential Rolex on top of that, but if you're trying to show up as a high level entrepreneur, and you're kind of tired, and you're not fit, and all those other things,
Mm-hmm.
it's just it doesn't present oneself in that way success level wise.
Are you a fan of I'm not a fan, but you support people that do testosterone if needed, obviously.
Yeah, if it's
Yeah.
if it's something that can help optimize someone, absolutely.
Yeah, because my doctor, when I first brought it up to him, he tested me and he's like, you don't qualify.
Mm-hmm.
And then I was just like, man, I feel tired every single day. And then, finally, about a year and a half later, he was like, you qualify now. And, I don't know the last time I went in there, when I was telling you I was doing the 1 ml,
Yeah.
he had told me that I tested 970. Now, I don't know what a chart's based on, but he was like, that's high.
But that's looking at the total. Really, really, the most important part is the free. So think of it this way. So total testosterone is kind of like what everybody, like all guys are competitive. So like guys will be like, hey, what's your number? And so like and the lab stops at 1,500. So like once you get above 1,500, you actually don't know like what somebody's testosterone level is.
Mm-hmm.
It literally can't read higher than that. So I've even had guys be like, hey man, like I'm so high I'm unreadable. It's like, that's not good, bro. Like that's not you basically, you want to take enough to get the effect that you're looking for, and not more than that.
So 970 may or may not be good for me based on what you're seeing.
It depends on what the free testosterone is. So think of it this way. Think of it kind of like a bus. So testosterone is the total testosterone is the bus, and the free testosterone is the active component, like the passengers on the bus that like would get off the bus and go be active and so forth, right? So it's the free testosterone that's most important. In general, the bigger the bus, the more passengers you can fit on it. So in general, if you increase total testosterone, the free testosterone should rise. It doesn't always correlate to that, depending on other factors. Like we have these things called SHBG, sex hormone binding globulin, which sounds exactly what it does exactly what it sounds like. It binds sex hormones and then it transports them. So it'll do it for both.
Like a party bus.
Kind of. So it'll do it for both testosterone and for estrogen. So there's these other sub things that you have to look at to make sure that it's.
He did put me on something this last time that I've never been on, but it was something something stole or something.
Anastasol, yeah.
And I think it's for what you just said. What is it? What did you just say?
For SHBG.
Or estrogen.
Yeah, for
estrogen.
Yeah,
it says take one on one day, one on Wednesday.
Yeah, and so I have a bit different of a mindset surrounding that, and I'll explain why if you want. So again, going with this whole mentality that guys keep, where they're like, okay, well, I want to have my number as high as possible. So testosterone good because I'm a dude, estrogen bad because I'm a dude, right? It's like every man has both testosterone and estrogen, just like every woman has both testosterone and estrogen, just different concentrations.
Mm-hmm.
So if you kind of take a step back and you look at things and you say, okay, let's shift gears completely. Let's look at heart attacks. Like the number one thing that kills people in the U.S., our country, like heart attack and stroke, it's cardiovascular disease, right?
Mm-hmm.
You have other things, you have cancer and diabetes, et cetera, but we're still in the lead for heart attacks. So if you stop and say, okay, well, the average age of menopause in women is 52. And menopause is when all of a sudden estrogen levels drop, right? So like how many women under age 52 do you see having heart attacks? Really not many.
Right.
And it's because their estrogen level is so high. But the interesting thing is once they pass menopause, now all of a sudden heart disease in women skyrockets because their estrogen level dropped. So it was the estrogen that was really cardioprotective. So bring it back to the whole scenario of male optimization. Therefore, as you increase testosterone levels in a man, their estrogen levels are going to increase naturally because the body's always trying to keep things in balance, right?
Mm-hmm.
So if you don't suppress those estrogen levels, as long as they're not going too high, which they usually don't, well, then now it's this extra benefit that a guy's getting of having this slightly higher estrogen level that's decreasing inflammation in the cardiovascular system and decreasing risk of heart attacks. Like, why would you want to take that away from them?
Yeah, no, I get it. Yeah, no, I was like, I definitely need to ask because I'm like my primary care physician. He's actually a foot doctor.
No.
So
Well, damn.
not that doesn't mean he doesn't know other stuff, but
But it's especially his feet.
yeah,
Yeah.
I know.
Yeah.
Yeah.
No, I had a funny thing. So and this was another thing I wanted to ask. So I'm prescribed Xanax and Adderall.
Mm-hmm.
How did I get over to the Xanax? Well, when we were traveling the world, we all got hooked on Ambien because we didn't know when to go to bed, what day is it, what time is it.
Sure, yeah.
So it became an addiction. And so then when I actually rehabbed to get off of the Ambien. And then a doctor put me on, it was funny because he was like, we don't want to put you on that. We don't want you to think that you have to take this pill to go to sleep. So he ended up putting me on an antidepressant.
Mm-hmm.
I think it's called anatriptyline.
Mm-hmm.
You heard of that?
Yeah.
It was funny.
Old school.
I actually looked it up one day.
Yeah.
And it said we have to look it up because it's crazy, but it said the highest dose of depression medication. So I called him and I'm like, I'm not depressed. Like, why are you putting me on that? And he's like, I'm putting you on that for sleep, so you can like hopefully naturally fall asleep. Well, like I said, again, I have such bad sleep issues. And, I think I'm sure I have anxiety, but I started taking a full Xanax to go to sleep every day. I've been doing that for 3 years. I know it's horrible. So I'm like, what would be the, he had even told me, I mentioned it to him one day and he's like, don't be taking Xanax to go to sleep. He's like, I'll put you back on Ambien. And I'm like, no, I'm not going back on Ambien for sure.
Yeah.
And then, some people are like, oh, take a melatonin. And I'm like, no, you can't go from tequila to wine cooler.
Yeah.
I'm like, so I'm at that stage right now. And the Adderall, not so much. That's when needed. Again, I feel like that's a testosterone. Like if I'm going out, I don't want to drink Red Bulls all night. I'm not doing drugs anymore. So I might take a half of a 20 milligram Adderall.
Yeah.
But again, I'm seeing people abuse both.
Sure.
So I'm like, what would you recommend for sleep? Because again, I guess I'm dependent on taking this Xanax to go to sleep. But something I feel, why I know the anxiety's there, I heard it's in your system 12 hours. So I always say when I wake up until about 5, 6 o'clock, very chill. My day's smooth. And then as I get into the night, I start to get anxiety a little bit. And so I'm like, well, you know what? Maybe if I broke it in half and took one earlier or whatever. But I just know in general, I don't, Xanax is probably not what you want to be on.
It's not ideal,
Yeah.
So let's talk about Ambien first. So
Yeah.
the problem with Ambien is it lasts a long time, right? Just like the half-life of the drug is longer. And it kind of has to be as a sleep medicine, right? Because it's supposed to help you get to sleep and then help keep you asleep. That's kind of the premise behind it. And it's a class of drug called a benzodiazepine, which is the same class of drug as Xanax or Ativan.
Yeah.
Like they're all cousins of one another. The difference is the half-lives are less. And so the half-life of Xanax is less than Ambien and then Ativan is less than Xanax. So it's not ideal, but at least on the positive side, at least you're using something that has it's not going to last in your system as long. It'll maybe last 4 to 6 hours and then it kind of goes away, So you can develop more of a psychological dependence on it, meaning that like if you're out, you're like, fuck, I'm not going to sleep tonight.
I've done that.
Yeah. And then with that, then you start getting anxious about the fact that you're not going to fall asleep, which just makes you even more anxious. Right. So there's that component. They can have a bit of a chemical dependency on it as well,
Yeah. I always felt with the Ambien, I'd always be like, when I need to go to bed, it needs to be right now.
Yeah.
And it would take you out within, it seemed like a couple of minutes, but then you would wake up wide awake 4 hours later, feeling great. But obviously you only slept 4 hours. So then, then you're crashing, a little later on in the day. But I mean, with the Ambien started getting crazy.
Yeah, it does.
People driving cars, not even knowing they're walking around. I used to
man.
I used to walk around. I'd have like 10 bowls of cereal around my house. And I was like, And the crazy thing, what actually got me off of Ambien, which was nuts. The Vietnamese lady was actually like, "Oh, please get off these. I've seen a lot of bad things happen. But for me, I'm not a gun person at all. I always had a gun that I would leave right next to my bed. And one particular day, I wake up and it's not there.
Oh.
So I'm blaming friends. I'm freaking out. Like, I got to call the police. Like, the gun's missing, and I just let it go, for a minute. And then, about a week later, I went downstairs to get a bowl of cereal. That was my little thing I did. The gun was in the cereal box.
No shit.
And I said, at what point in the night did I wake up, take this gun, go downstairs, eat a bowl of cereal, and then put it in the box?
Yeah.
And I was done after that. So it was one of those things that scared me straight.
Good.
Because, I was hearing people would go on car drives, and I'm like, and certain entertainers I worked with were going out in front of 50,000 people performing and saying they didn't even know they were out there.
Yeah. Wow.
And I was like, Jesus, like, yeah. So I'm like, again, I'm like, I'm very, I do not like to feel, like have to take that to go to sleep. So, I've been kind of like searching, like, what is a better remedy to try to get off the Xanax? Because, to me, I drink a little bit. I don't party that much anymore, here and there. But even when I drink, I'll set a watch for like 2 hours. Because I'm like, I'm not going to go out and drink a bunch of shots, come home, take a Xanax, and go to bed.
Right.
That's very lethal. So I wait.
Yeah.
Like 2 hours has to pass before I take it. But I don't know. Xanax has a bad stigma, but I'm like, I'm searching for a better method.
And there are. I mean, this is actually pretty common. So again, I work with pretty high level entrepreneurs, right? So, when they're laid down to go to bed at night, the laundry list of all the things that they're doing, they're like sitting, it's going through their head, And so because of that, they'll either have a hard time falling asleep or fall asleep for a short period of time. And then they'll sleep for like 2-3 hours. Then, all right, well, I'm up. Let me just go ahead and get rolling here,
Yeah.
So there's what it comes down to, man, is trying to figure out ideally where the anxiety comes from. Like that's kind of like point number one. And then trying to unpackage all of that. And then if that's still, if that doesn't do the trick, then there's some simple things putting in place. For example, it's kind of a sexy thing nowadays. Like everybody's talking about like alternating sauna and like a cold shower.
The cold ice baths are really popular.
So it's a popular thing, but there is some legit studies that really actually show how they can actually really calm anxiety overall and can help you sleep. So sometimes it may be bringing in some components of that. And then if you absolutely have to have, something chemical to help, then there are some other things out there that are safer and lower dose that if you needed something, you could take.
Yeah. Well, that's what people freak out when I tell them that. I'm like, I take a bar. And they're like, you eat the whole bar? And I'm like, yeah, but it says on the script I can take 2, but I'm like, I'm only eating 1 a day. But they're like, that's super high. They're like, we just take a little piece of it, when we want to go to sleep.
Sure.
But I was like, I came off Ambien, I'm like,
so you're still a step in the right direction.
I think what did Charlie Sheen call Ambien, the devil's aspirin?
Yeah.
That's what. And when I heard that, I was like, oh my God. So what's that?
Oh, I just wanted to ask something. Do you deal with women who, after they had a baby?
Sure.
Yeah, obviously there's a bounce back. And then also there's, as you have a baby, you have to, make sure you're all healthy in there because you don't want to give any of the bad stuff to the baby. When I had a baby and stuff, and actually, my bounce back, I was enjoying it. I ain't gonna lie. I was enjoying pregnancy, but then it was also because my industry is so vanity and stuff like that. The process to get my size back down. I mean, first, I felt like postpartum is probably when you look at yourself in the mirror after you had the baby because you're like, all right, we did it. And then you look at yourself and you're like, I don't know who you are.
Right.
But there was a lot of things I had to learn. I couldn't exercise the way I normally did. And so that was like a process because your abs like separate, right?
Yeah.
When you have the baby. And then there's a term for when they
diastasis recti.
that one, yeah. So I went down the YouTube. Well, first of all, I was like, okay, I'm ready to like work out, and they were like, okay, well, you have to wait until like about like 6 weeks after you had the baby. And then I was like, all right, I'm just gonna like go back to like my methods. But then I watched a lot of YouTube information, and also like looked at actual like demos of like workouts. And it was crazy because I'm like, holy fuck. I'm like, first of all, I have to be on this very like adamant schedule for the baby. And then when you get your time to like work out, and then you're like, I can't even work out like
The way you want.
the way I want. And it's very critical that if you actually overexert yourself, like you could even if you're just like laying down and you get up using your abs, like you like I never realized how much little things that you use your abs for.
Yeah.
And
sure.
that was, I mean,
Have you, in your medical career, have you ever delivered a baby?
no.
200 actually.
Oh,
200?
wow.
Whoa.
Yeah. In order to finish residency, I had to deliver 200 kids.
Oh,
Holy cow.
Enough that I was like, you
you're
know what?
full
I don't wanna
family
deliver.
practice. Yeah.
You don't want to be the quarterback no more?
Well, the nice thing is it's so like 95% of the time, the delivery usually goes well. It's that 5% where it's that's where problems can occur, and I don't know why, but like the doctor usually gets all the credit. So it's like you literally just stand there and catch.
Yeah.
Mom did all the work, and they're like, "Oh, thank you, doctor." But kids like to show up at like 4:00 in the morning. That's not like
But well, you know what was scary for me, because it was like I don't know what to expect. I'm like, all right, I had my period, I've lost my virginity. And it's like you don't know, like, and I was like laying around like when I was pregnant. I'm like, I feel like I should be reading a book or something, or do I like gotta watch movies? And so I was about to actually be like, okay, I'm getting C-section, until I told a girlfriend, and I was like, I'm gonna get a C-section. They're like, no, the fuck you're not. And I was like, well, I'm little. This baby's gonna grow. There's probably no way I can like have her naturally. Until I actually, I saw like a documentary on women. They were like showing their scars and, talking about how beautiful it was. But then there was another article that I read about that if you actually elect to get induced at 39 weeks, it's still healthy, that the baby is full term, but you actually reduce your chances of needing to get a C-section. So I was like, I read this probably like maybe like 4 weeks before I was actually going to deliver. And I told my doctor, I'm like, all right, I know my plan. I was like, I'm going to get a deuce. And they're like, okay. They're like, all right, so we're going to schedule it. Or I'm sorry, actually, it was probably like 2 weeks. Because then I remember they came back and they were like, all right, so you're going to come back on Tuesday. That was like the next week. And come in at midnight and we're going to do it. And I was like, okay. I was like, all right, we're going to do this. And then my anxiety was like so like high that actually the induced medicine, they like ran out. So they had to like order it. So I actually got like a 2-hour delay, which I was like, fuck yeah. Like take your time, get that medicine. But then like once they did it.
They ran out of the inducing.
Yeah, they said it. Yeah, it was really surprising.
Again.
So they like ran out of it. And I thought that was like the heavens being like, hey, we're just going to like give you some time. And so then like, we go, and then you got to wait to get your epidural. And that's a big thing too of, there's women who don't want to get the epidural because there can be some stuff where, it can affect the baby. But then at the point that your levels are so, like your anxiety is so high, and then don't even get me started on the contractions. And then, and you have to wait till you get 4 centimeters. And so I'm still like, I'm like trying to like, calm down these contractions and like, are we there yet? Like,
Hey,
I'm
listen,
ready.
he's been there with you. He
And
knows what's
then
going
I
on.
got the
I've
epidural.
never felt it myself, though.
Yeah.
Well, once I got the epidural,
Yeah.
I was like,
Game on.
oh, we're doing this.
Yeah.
I don't know what's going on down there.
Hey, this
but
is
then,
being that she's one of my good friends. This is a horrible joke to say, but every girl that I've ever known who's like in the maybe 105 pounds and down,
Yeah.
very tiny, all C-section. My son's mom, C-section, and like I said, people make it so bad, like scars. I think they've gotten so good today, but I told her, I said, oh, you're getting a C-section for sure. And then when she didn't, I said, maybe it's because you're a porn star. Maybe that's why you're able to. That was my horrible joke. But
I don't think so, because there is some ways. I had a friend who
because what did you weigh when prior to being pregnant?
I got like
No, I'm saying-
65 pounds.
Yeah, but what did you weigh?
I was like 100 before I got pregnant, and yeah, I was
So
like
usually 100-pound girl.
and
it's
my
like,
blood pressure, like my blood pressure was like was raising, so I was kind of like teeter-tottering, where I was like the high risk. I wasn't fully there, but I was still like there. I was like kind of there. And then so once I got my epidural, I was like, all right, we're doing this. But then all of a sudden I felt everything in my left, in my left thigh, and I was like, yo, we need to get me more. So they did give me more, and I still felt it, and I was like, yo, what the fuck, like, get this out of here, because I was coasting. And then they were like, oh, well, the baby's sitting on a nerve, and we really can't give you any more drugs. So, yeah. And they're like, and you're 10 centimeters, so it's time to go. And I was like, oh my God. But, it's like it's a woman thing, because I felt like every fucking ab workout I ever did led me to the point of like having my baby, where I'm pushing. I just wanted to take a nap, and I had to like do the things. There's like a rhythm to it. And then finally when they let it out, I was just like, oh, I was like, can I just take a nap? But you can't really take a nap. And then it was also like, it's satisfying once you meet your little nugget.
Yes, absolutely.
Yeah, I can't. I knew I had the chance to watch my son, and I was like, no fucking way. So like you being a doctor that delivered 200, did that change your outlook on women organs to see babies come shooting out?
Oh yeah, I mean,
that's what I'm like. Very like, I get freaked out, and I'm just they're like, you want to watch? Nope, I don't want to watch for some reason. But people love, a lot of people love that.
Yeah, well, I mean, the cool part is that you really see like life being created.
Yeah.
And it's, I don't know. There's with it, there's an appreciation. How. I mean, after 200, like I've seen a lot, but there's an appreciation for the difference between men and women, because that's something as a dude you can never do. You just can't. And so with that, you start to look at women in a different way. Like it's like, like not only beautiful and attractive and so forth, but it's like you can create life.
I feel like moms are hot.
I'm
People
that's why like
so
now as a I could really say I'm a full-on woman. That I guess back in the day when I was maybe into like the submissive play, I was like, oh yeah, but like when guys try to like talk to me now, or they try to be like any near like dominant, and I'm just like I'm like, sir, they'd be like, oh yeah, you want to call me daddy? I'm like, I'm daddy. I'm like, I had a baby, okay? Like, what did you do?
Right.
And I bounced back.
Right.
Like, that's crazy. And then it's like just watching your child like grow, but then it's also, the amount of pressure of like, because you get scared of give you a lot of knowledge to stay on top of your child's health. And then it's like, I mean, I don't know. It's just like a mom thing now, where you're just like I would like research something or something will come my way, and I'm like, oh fuck, okay, we gotta like make sure we narrow it down. And
do you have any kids, by the way?
Two.
Two
that I know of. Yeah.
that you know of.
Kidding,
What's the
kidding.
ages?
Two. I have two little girls. They're 11 and 13.
Oh wow.
Yeah.
I just want to know. I got a 3-year-old. I just want to know, does it get easier or the
No.
problems just increase?
No.
Especially with a girl. I had a boy and then girl. And girl is way different than a boy.
Yeah, I mean, I've only had girls, but it was something because if you would have asked me before I had kids, like, what do you want? You want a boy or a girl? I would have said a boy,
Yeah, that's what I
And-
think everybody says, that even girls.
Yeah, and I mean, my daughters, they're absolutely amazing, and I can't imagine not having them. They're
Yeah.
the best part of
Yeah.
my life. So
So we have a friend that actually he just did a thing. I'm sure it was a lot of money, but he was saying that they were doing something with the embryo. He flew to California with his wife. He has twins,
Oh, yeah.
but he was able to pick that he was going to have a boy-girl twin,
wow,
and then he was able to pick that he was going to have a boy. Now he said, I guess it didn't take, so they're going to have to do it again. But I'm like, how the hell does that happen?
I mean, at this point, I'm not that surprised. Like the advances.
That's what I
that
said.
are
I'm
there,
just like, that's
Like even these surrogacies. And
yeah, there's all kinds of advances. I mean, in all across all of medicine,
yeah.
So yeah, I mean, example for you. So one of the tests that for folks that come through our process and become invited to be one of our platinum patients, we don't take that many patients on. Like we're only taking 50 patients on this year. But one of the tests that we do annually on those patients is a cancer DNA test.
oh,
And so it's pretty cool. It's literally, it's just 2 vials of blood. That's it. And the neat thing about this, and it makes sense if you think about it. So cancer DNA, it has to be different than the person's DNA, because even though it's growing or could grow within the person, because it's growing at a different rate and, at a different cell type, it's going to be different. So nowadays, like, it's crazy to think the technology has gotten to this point that you can draw 2 vials of blood and check for 55 of the most common occurring cancers in someone.
shit.
Oh, my
Whoa.
God. I definitely need to do that.
You know? So you want to talk about in terms of like prevention,
Yeah.
like, if you think about like, as we get older and so forth, as the body breaks down and ages and everything, so the risk of all those diseases come about. I mean, if you're on top of it and you're constantly monitoring and making sure that everything looks appropriate, the chances of that just drop dramatically. You add on top of that the performance piece where you're really getting optimized, so that way you can be your absolute best. And then you combine that with the longevity piece to really protect what you have, to try to slow aging as much as you can. And I mean, that's where I think we're at a really exciting time.
Yeah.
Average, like most people die around 82, 84 years old nowadays. I think like within all of our lifetimes, that's going to get pushed back, to like, you're going to see folks that like being 100 is just going to be a normal thing.
Oh, wow. Yeah, I mean, I see that where do you see that in, like, Asia?
Depends. Yeah. There's
Different.
there's different people that are in different countries and nations.
They call them blue zones.
Sure.
Yeah.
They call them blue zones. These are these areas of the world that, where folks basically, there's like Okinawa, Japan, for example, and Sardinia, Italy is another one. They have some of the Mediterranean. And the things that you see, the commonalities across those are that folks eat a pretty clean diet. So it's usually like lean meat, fish, fresh fruits, fresh vegetables, things like that.
Are you big on green juicing?
No.
Nope. Okay.
No.
I always wonder, and when I say green juice, so I had a girl, and she had told me not pressed. When you go get the pressed, everything's already dyed.
Yeah.
So she was saying like a real green juice is when you go to Whole Foods, they do it right there, and you drink it right within that 10 minutes.
Yeah, I mean, it's...
And they were saying, I was being told it was like a fountain of youth thing, like it keeps you. But I mean, but do you feel that way?
I think if you like eat good quality food, like, fresh fruits, fresh vegetables, things like that, it's the same idea. You're just eating that instead of, combining it into juice.
Are you into any like the
You,
proteins or anything? Like
Yeah.
people that work out, you should drink a scoop of protein.
Yeah. I mean, so for example, like, for anyone who's really, when you're trying to either maintain your body weight, or as we age, it's way easier to put on, fat.
Yeah.
Right? It's just part of it. So ideally, you should be eating about 1 gram of protein per pound of body weight. It's a lot.
Yeah.
Like if you stop and think about that, it's like, holy shit. Like, so somebody who's, 185 pounds, 185 grams of protein per day. So if you look at everything that you're eating in a day, okay, is this sugar, is it carbohydrate, is it fat, etc. If you're spending that time eating that much protein, it leaves very little room for junk food and such.
Oh wow.
Mm.
So that's why. So
do you
that's why
think
people walk
these,
around with the shaker.
Yeah.
These blue zones, do you think that it could be, if it's third world countries different from America, where we have these chemically,
Like processed food.
yeah,
and
the
everything.
processed food
Yeah.
and fast food and stuff.
Sure. Yeah, I think that's a big part of it. I mean, if it's something that's like really heavily processed and has a bunch of preservatives and everything, it decreases the nutritional value tremendously.
And I feel like it's scary because it's like, as we eat this, like now we're kind of seeing people having these bad after effects with it. It's like, how far are we going to go until it's just to the point where it's done so much more damage, but we're still sugar is just, or corn, it's in everything.
Yeah.
And it's hard for us
The
to
thing I don't understand is where, when we talk about government stuff, like,
Monsanto.
so I know growing up, like, where was organic? Where was the organic
It
banana?
didn't exist, man.
Where was the where was the alkaline water?
Right.
Like, why is this a trendy thing?
Like now we know about BPA plastics. I remember when
yeah.
when
This is
microwaves were I remember when microwaves
that
were
was
invented.
hot. Yeah.
Right? And you
Yeah.
get you get a Hungry Man meal and you're like, oh man.
Oh my
I'm living
God, I
large.
loved those.
I grew up on TV
Yeah.
dinners
Yeah.
for sure.
Yeah, TV dinners. That used to be real.
Salisbury
Yeah,
steak.
yeah.
That was my shit. Man, that's crazy. So tell us just about let's get a quick rundown on what you do and what your service is at Blindspot.
Yeah.
Yeah.
I saw you. I didn't get a chance to look at your website, but I'm really interested. So what's the process?
Yeah. So,
Is there like a cost? Is it almost like you set up like a university? Like,
yeah.
what do you have to do to get started?
So folks, they go to the website, so blindspotmedical.com,
Mhm.
and they go, you put in your information and you apply. And so we see if someone's a fit or not.
What makes you not a fit?
So there's some folks that, for instance, like we don't work with insurance companies, period.
Yep.
So it's cash based,
Mhm.
and it's done intentionally. And the reason why is because most folks don't understand that insurance companies harvest your data. And as soon as you sign on with an insurance company, like, you get your annual physical, for example, and your doctor orders some baseline labs. Your insurance company sees like when your visit was, what it was for. There's diagnosis codes that the doctor plugs in, so it's all listed and so forth there. What labs were ordered, the results of those labs, the medications that were ordered and so forth. They see all this stuff, and they have, they run these massive databases that basically it plots it out that they can predict when somebody's going to die within about a year or two's accuracy. Now, is any of that information shared with the patient? No. So it's all done to protect their revenue cycles.
Oh man.
Wow.
So we don't work with insurance companies at all. And when you look the system as most folks know it, it's kind of like describing the Matrix to folks. Okay. So it's like the system as most folks know it. It's all these the complications and everything. It's all because of these insurance companies that are there. There's hundreds and hundreds of middlemen that are all there. So when you step out of that and you go the cash road, it's usually less expensive, way easier, faster. I mean, like
Definitely that
Yeah.
for sure.
like all the things that somebody would want,
Yeah.
right? So there are some folks that they're like, no, I work my W-2, I pay $600 a month, it gets taken out of I'm sticking to my insurance. Cool, that's great. You're not gonna fit with us. It's just not gonna work.
See, that's crazy you said that because my doctor that I said that just had that little VIP program from Detroit.
Mhm.
That's basically what he was saying in a nutshell. He was just like, so when you say that, something that comes to my mind first. So let's like the people without insurance per se. When you say it's this much money, I mean, even being as a doctor, even if you worked in the field of insurance, does it feel weird when somebody comes in and it's like you can't treat them because they don't have no insurance or
No.
no?
I mean, and the reason why is this is because it's like when somebody comes in, Either they're going to see themselves as an asset or not. And that's a mental shift. So when you begin seeing yourself as an asset, like you make the money, you
Right.
create the opportunities, like you create the life that you want, right? So when you start investing in yourself, that's when things can really make a shift and change. I see this all the time. Women are better with it. Like they're way better with it. They'll like, I'm an investment. I'm gonna like. So I think because women will go get their hair done or their nails done.
Yeah.
Like they, they do that. Guys, terrible at it.
Yeah.
Guys want to spend like no money whatsoever.
Yes. Men
On their
are
health.
very mathematical, where women were like, okay, if I do this,
Yeah.
this is going to benefit me in this department, so I'm willing to take that leap
Yes.
of faith.
Yeah.
Guys are really like, well, I got food. Well, I'm going on vacation, so I want to leave a little pocket, and I want to have my reserve pocket, maybe go to the strip club or wherever.
Exactly.
Yeah.
Yeah. And so
Yeah.
instead of spending money on their health, guys will be like, I'm going to go. I saw this $60 supplement on Instagram. I'll just take that.
Yeah.
Check the box, so therefore it must be good.
Hey, I got enough followers. I might get like an influencer discount.
Right. And that's what guys do. And it's something because it's not just guys who don't have money. Like guys that are like mega wealthy, they'll be like, you know what? I had a physical a couple years ago and I take a vitamin C. I think I'll be all right.
Yeah.
So we attract folks that they see themselves as.
So people hear
asset.
about you. They come to Phoenix.
Yeah.
They get enrolled. If they're a fit, then is there an upfront fee? Is there a yearly?
I'll walk you kind of through the process. So,
Okay.
so folks basically come to the website, blindspotmedical.com. They fill out their information. Then we have a series of questions that they answer. And that series of questions really helps to dictate like what program would be most appropriate for them. We only have two. And so the executive physical, which folks fly out to Phoenix, they stay in a nice hotel, where they're chauffeured back and forth to the imaging center. I'm with them the entire time. We do extensive labs, essentially head-to-toe imaging, and we get the facts of where somebody's at. And then based on those facts, you can really see, first of all, if there's any problems, which we've found all kinds of things, like
Wow.
tumors, impending heart attacks, early Alzheimer's. I mean, we found all kinds of things. But even if we look at everything and somebody has a clean bill of health, that's a really big deal to say, okay, look, we've looked at everything, and basically, we don't have a crystal ball. You could get hit by a bus, but
Yeah. I
you
feel
have,
like this is what Nick needs to hear.
Yeah,
our friend,
totally.
because it's in his head, I think. I'm sure there's something, but I mean, if you were to tell him, like, hey, dude, you're good.
like you're good, and so
You'd feel great.
and then you have like, okay, here you have because basically like a stamp of approval for the next 5 years. What do you want to create in the next 5 years? Because now you have no more excuses. Now it's not like, well, I have a little bit of a headache. I mean, it could be a tumor. Let me think about that. So now it's like, okay, it's go time. So over the next 5 years, especially if you're at this place in your career where you have a skill set, you have a mindset, it's creating the appropriate habits that you need to have in order to move you forward.
Mm-hmm.
So we get the facts of where someone's at. That's the prevention piece. The next piece is the optimization piece, so the performance portion of it. So, we basically, for folks that if we get along well, then and there's space available, then they're invited to be a platinum patient.
See, now what I was telling you about how I get anxiety, I have anxiety because I feel like now you're my friend, and I'm like, what if I fill out the application and I get denied?
I do well.
Be like,
It depends. Do you want to invest in your
so that would be what would get me denied. Is it's like, do you want to invest in your health? And
You're
I
like,
check
no.
no. So then it's no question asked.
Saying like, do you want to use these insurance companies to crutch you through all these little things where they can withhold some very
They dictate it.
credible information that you would want to know, but they're in the business of, you need to come to us and stay sick so that you can, fund
It's sick
things.
care, not
yes,
healthcare.
yes, exactly.
Yeah.
Or do you want to have the private jet experience, your Jet Suite X
Jet Suite X is
and
still
you
not at
know,
the very top, but
doctor examination.
So for folks,
Yeah.
basically when they come through the website, what
Yeah.
I did was, because there's some folks that the executive physical that I'm talking about, we have, we do $52,000 worth of testing for 15K. Okay. There's some folks that are like, oh man, I'd love to do that, but I really actually don't have 15K.
Yeah.
Right. So I made another layer to make it super easy, and I call it Blindspot Baseline. So for folks who just want to have like, look, I'm not gonna fly to Phoenix. I want to do this in my hometown, and I want to get some baseline labs, and then like sit and have you go over with me, like, where am I at? So I created Baseline as well, and that's $597.
Wow.
So at least that way, so folks have,
597.
I see.
Yeah.
Okay.
yeah.
Do you ever see people try to do that? Like, so they do that, and then something in that 597 test, whatever reason, gains that trust, and then they'll go
Yes.
to yeah. Okay,
Yeah.
That's an easy one to.
And I know they have to come to Arizona, but are most of these people in different markets in Arizona?
Oh yeah.
Oh, okay.
I have folks that come from I had a guy last week. He came from Brazil.
Wow.
Yeah. So yeah, I have folks that come from
Do you have a team that works with you, or is it just you?
I mean, the medical side, I do all the medical stuff. So I have.
So you don't have other doctors with you; it's just you.
No.
Okay.
I play things very close to the chest because I want it done a certain way. So.
Oh yeah,
That's amazing.
that would make me feel good. So then, okay, so you got the 597, you got the 15,000, and then, I mean, in those memberships, I mean, what is it like not like a membership, but in that diagnostic, what other access do they have for you? Like, so say I'm in your program and I'm like, hey, I feel like I got a sore throat, or I feel like I'm getting the flu.
Yeah. So for folks who get invited to become a platinum patient, then it's a monthly fee, and it depends on whether it's just the individual or if they're going to bring their family on board. We prefer to take care of like mom, dad, kids, because it's just if you're gonna having a disparity where it's just like dad being taken care of, then it usually causes strife in the family.
Yeah.
So we'll.
Oh, and one, I believe when kids are sick, I mean, I always say kids will nuke the whole house.
Oh, for sure.
They take everybody down.
Absolutely. So essentially in the Platinum Patient Program, we have, mom and dad, they're having quarterly labs. We're watching very closely. So it's not a cookie cutter type approach. It's unique for each individual how we structure this, but they're having quarterly labs. We're doing the annual blood cancer testing, like I said, and then it's also what it is that they're working towards. So if that's like, whether they want to lose weight, or they, need to fix their libido, or they're trying to bounce
That's what I was
back.
going to say. What if you want to become a porn star at 47?
I mean, that's, whatever somebody's goal is.
Whatever
It's
the
like,
goal
all
is.
right, what do we need to do to move you in that direction? Yeah.
Yeah. Well, man, that's
amazing.
that's interesting. And you said the majority of the people, it starts out as the male, and then, like you said, they'll get into doing their family.
Yeah, usually. But I mean, today was I was on a Zoom call with a lady today she was the one who like took the initiative.
Wow.
And she's like, my husband and I are coming to you. And I'm like, oh, okay, well, is he on board? She's like, he will be.
Yeah.
So,
Yeah.
so she made the decision.
Yeah. So when you're in the program, like you said, in order to, like, say I was out here in Vegas, in order to prescribe me,
Yeah.
I would still need to do that first visit in Phoenix to establish that you're my primary doctor.
Yes. Yeah.
And then from there, you could call me in scripts here in Nevada.
Yeah. Or
Okay.
if you're on vacation in Florida. Or
Yeah, because
California,
I have
yeah.
mine now. I've been in Detroit before, and
Yeah.
they've called me. But something funny, like I where I'm like, I'm definitely trying this program, is when all this COVID stuff was going on, and I'd like to hear your opinion on that. But the Dr. Wayne was really pushing it on me, and I actually came in his office, and he had probably 20 yellow envelopes, and he's like, "Go open that up," and I opened it. It was like deceased, and he's like, yeah, the youngest one's 27. So he was like pushing it, and he's like, listen, I'm gonna say my legal name. Don't use this listen, Steven, do you trust me with your health care? And I was like, Dr. Wayne, I don't know because you're a foot doctor and you give me Adderall and Xanax. So I'm a little bit unsure. But I was like, I do. But then this was the weird thing. Like, he was really laying it on me. And then what was crazy was, Domo here spent some time in LA where, people were laying it on. And when she moved back out here, she started laying it on to me to where I was like, she's like, you got kids, you need to. And I'm like, you know what? Okay, I'm going to do the shot. And then the next day I wake up to all these calls and she's like, we're not fucking doing the shot.
Beverly Hills people were really, it was actually funny. It was like the Hollywood downtown LA people were like, nah, fuck that shit. And the Beverly Hills people were like, no, like you're crazy to like even hang around us if you don't have it. And then my anxiety took in and I smoked a joint and I was like, all right, not doing it.
Yeah,
because I'm just so like, probably more into homeopathic methods, but like if I can reduce the amount of any type of medication dependency, that's how I am. So I'm super sensitive to like putting anything else in my body that I was just like, the vaccines were not. Like, I wasn't feeling it. And I'm like, there's not a lot of
I
knowledge.
always told people, like I said, I'm a rule follower. I said, as far as I know, I'm like, I'm a rule follower in some stuff. But I'm like, as far as I know, like, hey, you're supposed to get a flu shot, you get one. And I'm like, I think back and I'm like, the only time I've ever been sick 2 weeks with the flu was when I got the flu shot. And I mean, I probably haven't done one in definitely 20 years, whatever. And like I said, I'll get a cold usually once a year. I go through like a little few days of being sick. But what was weird is after this COVID thing kind of slowed down, I had went in to the doctor's office, and I was like, I was feeling like I was sick. So of course I think I have COVID, and I'm like, Dr. Wayne, can can I do one of those? And he's like, we don't. Those are all bullshit. I'm like, wait a minute, you're the guy that was pushing this on me now, and he's like, if you want one, just go get it at Walgreens. We don't even carry them no more. He's like, that's just all. He goes, I have Raiders season tickets. I think I have COVID every week. But I'm like, hold on. So was there an initiative for these guys to push? Did they make you get one because you're a doctor?
I did.
Did you do? So he told me he did for the doctors here. He said they did Madura.
No, but I was in kind of a different scenario. I mean, at that time, I was a hospital doctor. I was working in the hospital, like taking care of patients, and that was when COVID was hitting.
So you actually got to really see.
Oh, dude, I was on the front line. I
mean,
you took care of actual COVID patients. Wow.
I had to become like a COVID specialist on the fly because, you think about it this way, like most diseases, they've been around a long time.
Right.
There's like, you can look it up in a book or go online to it. Like, even if you don't know the treatment plan, here's the treatment plan.
Yeah.
This was something totally new.
Yeah.
Right. And there
wasn't a solution made for it.
No. And it was weird because like on the one side, like, I come home exhausted, like end of the day, and especially with a 12-hour shift, you end up working like 14, 18 hours, right? And you're watching the news, and the news is like, makes it look like this Armageddon where everybody's dying of COVID.
Yeah, they did.
Right?
Yes.
And that's not what was happening.
The fear-mongering.
In reality, or at least in the reality of the hospital that I was working at in West Phoenix, right? And then you go on social media, and everybody's like, COVID's bullshit. Like, it's just a cold. And it's like, no, that's not exactly accurate either.
Yeah, no, I had COVID, and I felt exactly what it was. Mine was very mild, but I felt it. And then something crazy about it was I was actually at home, and I got the chills.
Mm-hmm.
And so like the hair on my arm stood up. I went to bed that night, slept 14 hours, and we were going to LA the next day. And I was like, I don't know. I didn't feel any other thing. All these things they say you feel. I didn't feel nothing, just the chill. And I was like, wow, that was weird. I slept 14 hours. So I told her, I was like, I need to swing through UNLV and get one of these drive-through tests. So when we did it, it's the U.S. military. And then she's like, oh, they're going to give it to you. They're gonna give it to you when you pull up in there. So I do it. We drive to L.A., and she has, her daughter with her. And we get to L.A., and my phone starts going off. And it's like, you have COVID. And then all of a sudden they call me. They're like, this is so-and-so from UMC. Are you
creepy?
Yeah, they're like, are you
Yeah.
quarantining? And I'm looking at her and her and her baby, and I'm like, yeah. And I'm like, well, what am I supposed to do?
Mhm.
I'm like, do I drink vitamin C? And they're like, no. And they were like, when did you think you got it? And it was really ironic. On her birthday, when we were thinking COVID was fake,
Mhm.
we had like 20 people here, and like 8 people got it.
Mhm.
And so they were like, okay, well, you've been past your 3-day mark, so just put on a mask and good. So, of course, we got a different room and whatnot. And then that was it. It didn't come back. And then something very strange. We were a gym that we both go to. They were like, hey, get a COVID test.
Oh,
or,
yeah.
or the
that
blood
was so
test
weird.
portion of it.
Mhm.
Nobody
The
drew
antibodies.
the antibody.
Antibody, yeah.
So it's in the kids' daycare part of the gym, and I was like, we should do that just to know.
Gave them blood.
We go in there, we give blood, and it's like, okay, a week passes.
And I think we also used our insurance.
2 weeks pass, 3 weeks pass,
Nothing.
and I go up to the gym. I'm like, hey, where the fuck is these results? And they're like, you know what? They're like, we're just check back. I'm like, and you're talking to the 16-year-old working at the gym.
Yeah.
And I'm like,
Check
check back. And I'm
backs.
like, okay. And then all of a sudden it got to this thing where they gave you a little piece of paper, and it was a company out of Huntington Beach. They never fucking told us anything.
They didn't
took
do
our-
nothing.
I'm like,
And it
"Dude,
was like,
nothing.
did you guys just take our blood and
Hey, what you do
do
with it?
an
What did you-
insurance
That's what-
and do it like
I
an
was-
insurance thing? Like, why did you bill? Why did I have to submit my insurance
Yeah.
card?
You called the number and it just rang.
Yeah.
Wow.
And the gym never said anything.
Well, the gym was also like, oh, well, we're the gym. These people came in and did it. And it was
Yeah.
like, well,
Creepy.
what's
Where's
going
the
on?
blood? I'm
yeah.
like, I mean, it
What do you
freaked.
guys do with my blood?
it
I know that
it-
they do that with a lot of people said, for the ancestry.com.
Yeah.
I guess you have to like submit blood, and there was a lot of weird stuff where people, I guess, this is just allegedly they were taking the blood.
Well, that's a
doing
good point,
something.
though. It's like your DNA's out there.
Yes.
It's like, what are you doing with it?
I mean, how can you? I'm like, even as a gym, it's a big corporation gym out here, and I'm like, you guys got to know where it's at. Like,
Yeah,
well, like
something.
you hired the people,
Right.
or somehow they worked out the deal. Never told us. So
Weird.
that was a very weird, and that was in the heat of
But
COVID.
with your services, you would never
Yeah.
have
no.
that
Did
type
you
of stuff.
did you fear so when you're helping these people, obviously you're around, did you fear, like, how do you know that it's safe for you to be treating somebody that can potentially put your life at
I
risk?
didn't. I had COVID 3 times.
Oh,
Like
wow.
we had, I was working at this, so first of all, like hospitals, their profit margin is pretty low, and so I was working with this hospital system, piece of shit hospital system. That's they're nationwide, and they operate with like a 2 to 4% profit margin. So they had no interest in trying to get us like the protective equipment that we needed or anything. No joke, the doctors and nurses were wearing garbage bags.
Whoa.
No joke.
Hey, what was
Whoa.
the deal with the ventilators?
Yeah. So
What was that?
Well, the thing with COVID, it behaved in a different way. So what would happen would be, and this didn't happen in everybody. So it was mostly folks who were already sick with something, like they had it was just waiting for the domino to be pushed over, So like the grandma who had smoked for 50 years and had COPD, right? She was like a prime target,
Yeah.
right? So you'd have somebody that would come in and they'd be like, well, I feel short of breath. And then EMS goes into their house and they say, okay, well, they're like around, normal oxygen levels are like around like between like 97 and 98, right? And so they'd go and they check them out. They say, oh, well, she's like around like, 89, 90, 91. So they bring in the emergency room, put somebody on oxygen. You go see grandma and she's like, oh, I feel better with the oxygen on. You're like, oh, okay. And then all of a sudden, like 4 hours later, grandma tanks. And you're like, what the hell is this? And you keep trying to wrench up the oxygen and it wouldn't be enough. So then you'd
Wow.
have to intubate and put them on a ventilator. And a ventilator is basically a machine that,
Helps them breathe.
yeah, you put a breathing tube down into their
Throat.
air
Esophagus?
passage, into the air
Okay.
passage, into the trachea. And so now this thing is forcing air into the lung and it's coming out. So when it would force air in, then, naturally it would start to make its way out. Well, the problem is that once the folks would go on the ventilator, they would have a really hard time coming off of them, because depending on how bad the case that they had, it would just take time. So now folks started to get this idea again, like goes through media and then social media and this and that. Oh, don't get put on a ventilator because then you're never going to come off. Well, it's like, look, man, if you're going to die, like there's not really a choice. It's like either you're going to go on the ventilator or you're going to die.
Yeah.
So then the ventilator's got a bad rap for no reason.
Yeah.
It
was just, I mean, the hardest thing was, when they're saying the person has COVID and they're showing on the news that their family can't even be there.
Yeah.
And you got to do a camera and whatever. And I mean, to me, that was just bonkers.
Yeah.
And unfortunately, when her dad was sick and stuff, he was in Texas. So I'm like, you're just listening to what I want to see.
Right.
It was definitely really scary, yeah.
Because
I couldn't even.
They would call her and do Zooms, but I'm like, what are they really doing? With them?
Well, what was crazy was I couldn't visit him because it was during COVID.
Yeah.
So they were very protective over it, and my dad had actually gone into a catatonic state. So he was just he was already to the point.
Not from COVID, just
not from COVID, but from other medical reasons.
Yeah.
And I had to do these Zoom meetings because, first they were trying to suggest electric shock therapy is going to be the solution, and I was like, this is no. And they're like, it sounds scarier than it is, and I'm like, that sounds really scary. And I was the next of kin, so my dad didn't have a will, so. He didn't prepare for this type of thing. So I was the closest, child to him. So I had to make these medical decisions at the time that my baby was born. So I'm dealing with life, and I'm also dealing with
I knew her during this, and I was just like, this is way too much going on.
I wish I kind of had the sense to take advantage of my gut feeling when I had to, because it was this weird thing, usually you want to be with your family member when they're hurting or they're in pain, but I was also in this situation, I can't pay and go see my dad, but I had to do these Zooms where they wanted me to attempt to just talk to him, try to get him talking, moving, because he was internally shutting everything down. They basically said, lights are on, but nobody's home. Yeah. And so I'm talking, and my dad kind of had a few, they would just be like, hi, how are you doing? And he would naturally answer. And it was just kind of really weird until they were really pushing this electric shock therapy on me. And I had to go through a process to sign as a guardianship or go into hospice. And it was really intense because I'm also I'm the child, but I'm also just talk to me. What do you want? What do you want me to do?
Tried.
But,
she had brought it up to me, but they had tried to make her sign something that was going to make her responsible for the medical
it would
bills.
have in
Don't sign
return. It was a lot, and it was actually costly. And my dad had VA stuff, so. But I think these doctors thought that,
they kept switching doctors.
Well, he had it. Yeah. Let me say, he had $1 million on there, and it was I don't know what you guys think, you guys are getting, but anyways, it just got to the point where it was really stressful, and I was just okay, I would have had to either use some of his money for this guardianship, but then, and he was a bipolar patient, so I just started to ask questions, and I was like, okay, so this electric shock therapy, it's supposed to help him get out of the catatonic space. But then what's going on with the bipolar medication or what is the follow through? They go, oh, that's electric shock therapy. What? I was like, so all the medication and everything that he needs, because it's a medication that he has to use for the rest of his life for this condition. Now you're saying that this electric shock therapy is supposed to cover everything. So I started to I felt very bad vibes about that and the whole process, where I was like, you know what, I would rather save his money for funeral services than to waste it and essentially make him, his quality of life go down because he would kind of turned into like a vegetable. So I was doing, I had one of my last Zooms with him, and I was just like, hey, like because before I felt like I was talking to an infant. I'm like, hey, hi, like trying to talk, and I wasn't getting anything until one, I was just like, I didn't know what the doctors were telling him or if he was, comprehending anything that was going on. And I was like, hey, Dad. I was like, they want me to do electric shock or hospice. I was like, we're going hospice. And it was like my dad looked at me like in a way that he kind of like I knew what he was looking at. And next day, or actually in the evening, he actually passed away in his sleep. Very peaceful, no issues, and it was probably the best that I was like, at least he kind of did it on his own terms, and it wasn't anything that, I mean, it wasn't
Well, remember
gonna...
they kept the thing that was so like shady? When she would answer one doctor, no, we're not doing the shock, the next day a new doctor would call.
Oh yeah,
so they kept switching.
They
like
would,
one
well,
was going to convince her to do it.
they kept trying to like talk to me, like to say, well, like, did you research it? Like, did you? Yeah, I researched it. It's actually fucking terrible. Well, they're like, oh, there's healthy benefits. Doesn't sound. I'm like, I don't know, maybe because I'm not a non-person that's not related to my dad. I'm like, I don't want like, just scary methods and their methods of pushing kind of some practices that are just like maybe not ethical. I don't know. For me, it felt like that. So.
It's a good thing you stood up.
Yeah.
For your dad.
And it was really, I mean, after the fact, I know that, doctors have to do this. They gave me a call after to thank me and saying like, my dad has been a great teacher to them because they were able to learn some more methods of how to take care of this type of condition, which is nice. But it was also just kind of like, you know what? I at least am happy that I took the initiative to educate myself and go, because I started, I'm like, okay, they're going to throw this condition out. I kind of, no offense, kind of don't believe doctors sometimes, and so I always want, like, I go into like extensive like research of it, where what are the pros, what are the cons.
Yeah.
And I mean, just a lot of the cons, I was just like, or just a lot of the side effects and stuff, I was like, I can't live with myself if I did that. So it was good, but it was just like, you really have to like, they have a timeline, that they want to, because there was an amount of months that he was in this state where they were like, oh, we got to kind of like figure out what are we going to do. And I think the whole shock therapy could have been something where it would have progressed them to make the final decisions of what the ending result, because it was just
conspiracy,
so scary because you couldn't go and physically see your family member.
My conspiracy theory behind it was, when she was telling me this, it was like, so when she laid the law down and said no shock treatment, he passes away that night. Like, did they do that on, did you do that on purpose? Did it?
That is a scary thought too.
Was it a fluke? But that's the whole thing with not being able to be there. It's like, you feel like you need to be there so you can actually physically see what's going on. But that's why I was like with these VA people, that's why I'm just like, I feel like they get to a point where they're like, okay, it's time to get this person up out of here. We've already took them down, every path. So I don't know. But tell everybody how they can find you, Dr. Boyd.
Blindspotmedical.com.
That's on everything. What about even Instagram?
Oh yeah, Instagram. So my handle's David Boyd MD. Okay. I think I have a TikTok again. It got taken over, and then I had to restart.
You got hacked.
I got hacked, which was so frustrating because I finally got to like 150,000 followers, and then it got hacked. So I was like, God damn damn it.
Yeah.
So for a while, I was like, fuck TikTok. I'm not going to do this again.
Yeah.
But I guess you have to.
Yeah,
so-
yeah.
Yeah,
You-
so it's David Boyd MD at TikTok. On
At
TikTok.
TikTok.
Also. Yeah.
And where can they find you
You
at?
can find me Domo Monster 7 on IG
And me, I'm old school, so I'm just on Green Room Radio.
because he got hacked.
I got
He's
hacked.
a hack
I'm like,
victim.
who wants to hack my account? But somebody hacked me, so
It's okay, guys. I've been deleted 6 times, so.
There you go.
But yeah, we appreciate you coming out.
Thank
and
you so
I
much.
actually,
This
I
is very
actually,
informative, and I hope a lot of our listeners take a lot of value into this.
Thank you so
yeah,
much. Thank
and,
you for
and I
having
and
me.
I think I definitely am going to get involved with this program.
Yeah, dude. Love
Yeah.
to have you.
Yeah,
Absolutely.
So, all right. Well, thank you.
Awesome.
See you guys
Thank
next week.
you.
All right. Thank
So-
you.